A dermabrasion is a surgical procedure whereby the outer layer of skin is removed or sanded down using a surgical wire brush or a diamond wheel, so that leaving a raw area which when healed will leave the skin much smoother and younger looking. The best candidates for a dermabrasion are people with noticeable acne scarring, chickenpox marks, aging skin such as vertical upper and lower lip lines or various other lines and wrinkles around the face, or even some skin discolorations and age spots. These can all be adequately treated with dermabrasion. People should avoid having dermabrasion are people with dark or black skin, people who have undergone a recent course of Accutane, or people who have unrealistic expectations. It's not necessary to see your GP first. A referral to a suitable surgeon or practitioner is adequate. In order to get the best from a dermabrasion, one should avoid sunlight in the few weeks before the actual procedure, avoid any active abrading agents beforehand, and you should clean your skin thoroughly beforehand and make sure that you're adequately prepared for the after effects, which can be rather unpleasant for about a week or two while the skin is healing. During the procedure, which can be carried out under local anaesthetic and sedation or general anaesthetic depending on the extent of the planned procedure, the surgeon will use a special surgical brush, which is a rotating brush on a drill or a diamond wheel, and just rather than sanding a piece of wood, carefully sand the superficial layers of skin until the correct depth is reached. After that is done, a suitable cream is applied, and the patient is then sent to the recovery, usually for an overnight stay in hospital. At the time of the operation, the skin is numbed, or the person is asleep. It's not painful, but any pain can be controlled after the procedure with suitable medication. Usually a superficial abrasion, most people will get healing within 5 to 7 days. Any deeper abrasion can take up to 2 weeks to fully heal. Patients are given a very comprehensive list of do's and don'ts and instructions, and usually we just advise them for the first few days just to rub the antibiotic cream until the area has healed. After a few days, you can apply lukewarm water with a soft cloth to wash the face, and then put the cream back on again until it's fully healed. You must avoid ultraviolet light, so sunbeds and sunlight must be avoided for at least 8 weeks afterwards in order to get the best possible results. The two main risks of this procedure are an increased or decreased pigmentation of the treated skin. This can take several weeks to right itself. The other complication is increased scarring, and people with a history of keloid scarring should also be seriously considered for this procedure. It can take several procedures afterwards to right this, either further abrasion or even injections, steroid injections into the scarring. In a properly performed abrasion, one can expect a much smoother, more youthful looking skin. This procedure should be performed by a fully qualified cosmetic surgeon who does these procedures all the time. The cost of this procedure, again, will vary. It will depend on the extent of the procedure and whether it's done at a local or general anaesthetic, but anywhere from £500 to £3,000 is the usual sort of cost.